Dr. Danny Governor, SD Body Fix. Have you ever had acute low back pain? Well, if you have, you know it can be a real nightmare. You're not sure if you should move, you're not sure if you should not move, should you rest, what should you do? Well, what I find is with my patients who experience low back pain, the best thing to do is to figure out a way to move relatively pain-free as quick as possible. But the goal is to find a couple different exercises that you can do without causing more damage. So I always like to select one mobility exercise, so something that'll get you moving and help with the stiffness, and then one stability exercise, one that will help activate those core muscles and stabilize that area that feels really unstable. First of all, there's no perfect exercise for everyone. The goal is to figure out what you specifically can do. These two exercises that I'm going to give you are two basic ones that I use with 90% of my patients when they are experiencing acute low back pain. I like them for a couple of reasons. Number one, they're very safe. Number two, they're in a very neutral position. We're laying on our back. It's very difficult to injure yourself more. And then once you start moving more and more, your body likes that. So you'll start to feel better faster and you can start the healing process. Laying around doing nothing does us no good. So let's get to the exercises. First, the mobility exercise that I like is called the windshield wiper, and it's very, very basic. This is how you do it. You're going to lay on your back. We're going to bend those knees and put the feet flat on the table. I like about hip or shoulder width apart. There's no perfect way to do it. And all we're going to do, our knees are the windshield wipers, and we're going to rock them back and forth with a nice steady pace. So you'll see when your back's really bothering you, you'll probably only be able to go this far. That's fine. Go to that end point, pause, and then go to the other way. You'll see you'll probably be a little lopsided. That's very common with this. Do as many as you can. There's no perfect number. They're very safe because you're on your back and flat. This really helps the joints of the low back, called the facet joints, get a little motion in there. And when you get that motion in there, your brain believes that you're okay to move, so it helps relax those muscle spasms a lot of time. So we'll go like this, back and forth. Just let it go as far as you can. Don't push it. We're not trying to twist and pop or crack. That's not the focus of this exercise. We're just trying to get some motion and mobility in there. So back and forth, just like this. Another exercise that I really like, which is focused more on strength, is a modified glute bridge. Here's how you do it. We're going to lay on our back with our knees bent and our feet flat on the table. Now, the modified glute bridge is called that because instead of squeezing our glutes and lifting up, we're going to stay in this neutral position. So this is how we're going to do it. You're going to press that low back into the table. That's going to activate these core muscles. Then we're going to squeeze the glutes really hard, and we're just going to hold it for 10 seconds. And then we're going to repeat that 5 to 10 times. Now, sometimes when the back is really bothering us, especially with a disc-related injury, pushing that back into the ground could bother you. So if that's the case, try pressing your tailbone into the table, ground, bed, whatever you're on. So we'll just press down, squeeze the glutes, hold for 5 to 10 seconds, and do it again. You should be doing this every single hour. The more you do it, the more your body's going to realize it's okay to move. And then after time, we can move on to more difficult things. What you'll find is after doing this for a few days, it'll get a little bit easier. You can do more, you can go a little further, and it'll be less painful. The spasms will start to diminish. And then we can graduate to some more difficult exercises that will challenge the low back a little bit more.